times. But the Oregonians that we've been talking to feel the justifiable fear and the financial pain ahead as their health premiums blow through the roof. That is literally what's happening. And Finance Committee investigators, our team, has found that in the last year, billionaires have raked in another $1 trillion worth of wealth. And I was talking to my wonderful friend, the leader of taking care of folks who are dealing with cancer, and we talked about the fact that the billionaires got the keys to the penthouse, folks, while cancer survivors in Oregon get kicked to the curb. So here's the timeline that we're going to be talking to all of you about. November 1st is the start of open enrollment. The insurance companies, we know, always drag their feet. And if they're allowed to drag their feet, and Senator Merkley and I are taking them on, they just keep jacking up your premiums. So that's one thing to watch for. And also, Republican senators are going to be coming back to D.C. as we will be tomorrow. And we're going to tell them what we've heard from Oregonians over the last couple of days, because in the last couple of days, we've been hearing folks saying, I'm getting hit with a sledgehammer as far as these health care premiums are concerned. And they are not just alone, the consumer, it's also the providers, and we're hearing from health care plans, and we're hearing from nurses. Time out for...
That's the nurses calling you.
That's the nurses. Thanks. It's never dull in the Oregon congressional delegation. So it's not just the providers that are hit, it's the consumers, it's the health care plans, and they're constantly faced with challenges. And I'm telling you, what I hear from cancer patients is they're having doors slammed right in their face as the plans have problems keeping the doors open. Last point that I want to bring up, and then in the parlance of the Senate, yield, as we say in the Senate, to my friend Senator Merkley. We know how to fix this. This is something that can be fixed, and we've shown it recently. Talked to Senator Dexter about this with the Pharmaceutical Benefit Manager bill. Nobody thought we could pass that. Billions of dollars in savings, and we got a vote by the close margin of 26-0. So we know how to put together bipartisan health bills. And I just will close by way of saying, make no mistake about the Oregon delegation. Our door is open. If people want to come on in, we're inviting them. We will even bring snacks. Let me invite my colleague, Senator Merkley, up here for his remarks, and we'll all just have quick statements and softball questions, believe you can give to me. Okay? Senator Merkley.
Thanks. Republicans have shut down our federal government in order to salvage health care for millions of Americans. The rates are going to go published 2 days from now here in Oregon and across the country. Those rates are coming out, and they'll become effective in January. And people will see both that the cost of the plan has gone up and the tax credits have gone way down. And that differential is massive. We are talking about, in Oregon, a 68% projected average increase. An average increase of $1,300 per person. And if we think about how many people are affected nationally, 20 million people by those rising rates. But let's just take this county. 32,000 people in Multnomah County depend on the ACA exchange tax credits. About a quarter of them are going to lose those tax credits completely, and the other 3/4 are going to see them greatly diminished. Well, the result is a whole lot of folks will go, if I pay this higher amount, how am I going to afford my rent, or pay my mortgage, or some other, put food on the table for the children? But if I forego health insurance, that's a huge gamble. We were just down in Eugene, and one of the folks who stood up and shared their story was saying a broken arm for a child who fell off a bicycle was $50,000. Said, what if I hadn't had health insurance? He says it was, just the percent that I had to pay was huge for his family. 20% of $50,000, $10,000. But what if he hadn't had insurance? And then, when people don't have insurance, they go to the emergency room. That's the most expensive care. And if it's not something like a broken arm, but it's a growth, and you put off going, maybe by the time you go to the emergency room, it's a far more threatening condition. Well, none of that makes sense. And then on top of all of that, if folks don't have insurance and can't pay the bill, it means less revenue. Less revenue to our clinics, less revenue to our hospitals. And some might be okay, but a lot of them are very close to the margin. That means they're going to have to cut programs. And across the country, the Sheff Center is predicting some 300 clinics, hospitals will be shutting down. Now, we went through the situation in Baker City of them losing their maternity program.
Maternity deserts, we call them.
And they have to go way down the road to be able to give birth to a child. What happens in the middle of winter in an ice storm or a snowstorm? So, very troubling attack on healthcare, which is just fundamental to folks. And that's just the start of the attack. Then comes stage 2. Stage 2 is savaging our Medicaid. Here it's the Oregon Health Plan. What are we talking about? Some 230,000 Oregonians losing their health care on that attack on the Oregon Health Plan. So a big amplification of the challenge. So we are going to stand strong until health care gets restored for millions of Americans. The Republicans have shut down the government in order to savage health care, and we are fighting to get that health care service back. It is a vision that has been part of this entire theme for this year, which is families lose and billionaires win. It has been the red carpet for the rich and red tape for struggling families. We want a better vision. And that vision is families thrive, and the affluent pay their fair share. Let me turn this over to next, Suzanne Bonamici. Welcome.
Well, thank you, Senator Wyden, Senator Merkley, my colleagues, Representatives Salinas and Dexter. Great to be with you today, although, we would all rather be in Washington, D.C., keeping the government open without slashing health care. And we've been there. The Republicans haven't been there for weeks, but we've been there. When we come home, I speak with people across the district I'm honored to represent, 1/6 of what the senators have, but I hear constantly that people are struggling to get by. And they're struggling because costs are rising, in part because of the chaotic tariffs, but healthcare costs are rising, but it's not just healthcare costs. It's housing, it's childcare, it's groceries. And the last thing these people need is for their bills to go up. So right now, our Republican colleagues are trying to raise the cost of healthcare, in some cases significantly. And they also say, we don't need to deal with this now. We can deal with it at the end of the year. But as we know, people are getting notices right now. We can't wait until the end of the year. So these policies, the Medicaid cuts, and the combination of adding the increase in the ACA, the prices because of the tax credits expiring, this is going to rip healthcare away from approximately 198,000 Oregonians, put hospitals and clinics at risk, especially in rural areas. I was recently celebrating the opening of the renovated new health center in Tillamook County. And we were joyful because it was opening, but there was angst because if these cuts go through, that's threatened. Dramatically increased premiums. And so just in the district I represent, about 18,000 people will have their premiums increased. So I was speaking with Teresa from Clatsop County. I met her several years ago, but she contacted me. She runs a wonderful little farm, produce, flowers, and her husband works at a local business that provides health care for him, but not for family. So like many Oregonians, she gets her insurance on the exchange. She just got a letter last week. Her premium has been $230 a month, and now it's going up to $1,077 a month. Let me say that again. It was $230 a month and it's going up to $1,077 a month. That's unconscionable. It's unacceptable. And she's very concerned, obviously, about this. She said she's about to turn 60. She works a tough physical job. She runs this small family farm that's challenging even in a strong economy, and she can't afford to pay that premium without the tax subsidy. But you can't afford to be without health insurance either, because we remember the days before the ACA, people still get sick when they don't have insurance. And then, as the senator was saying, then they put off getting preventive care, they go to the emergency room, that's more expensive, and it affects everybody. So, one illness, one injury could threaten her health. And again, if these subsidies expire, she may have to close her farm or go without insurance, and that's unacceptable. That business plays an important part in the economy of the North Coast. And she's not alone. Thousands of Oregonians are going through the same thing and receiving similar letters and being forced to make those impossible decisions between keeping their coverage and paying their bills in the United States of America. It's unacceptable. Teresa deserves security, not fear, when she gets sick or injured. Nobody wants a government shutdown. We've been there before. It brings uncertainty, instability, it delays important work. I've been hearing from leaders and community organizations, business owners who are wondering what's going to happen. It's especially disruptive for federal employees. I have a lot of Coast Guard over on the coast. They're all working without getting paid, and even their retroactive pay is now being threatened. We're going to fight that too. But I've been in D.C. We've been in D.C. waiting for the Republicans to show up, but they haven't been there for weeks. We are ready, willing, and able to work with anyone to get this done. But we cannot support a budget that decimates the health care for thousands of Oregonians and Americans. It's unacceptable. So we're heading back tomorrow. I hope my Republican colleagues show up. I really do, and I hope they get back to the table, because the American people deserve better. They deserve better than what they're getting. They don't need higher prices. They need to have their health insurance. They need to have that economic security that insurance brings. So we're going to continue the fight for a government funding bill that cancels the cuts, lowers the costs, and saves health care for Oregonians and Americans. So now it's my honor and pleasure to introduce my colleague, Representative Andrea Salinas from Oregon's 6th District.
Well, thank you to Senator Wyden and my House colleagues for hosting this event. As you all know, we are in the middle of a government shutdown because Republicans are creating a healthcare crisis in Oregon and across the United States right now. Earlier this year, Republicans passed the largest ever cut to Medicaid in our nation's history, which will impact millions of Americans and hundreds of thousands of Oregonians, including thousands in my district, in Congressional District 6, causing them to lose their health care coverage. It's either going to be too expensive to the point where people are not going to be able to afford it and have to choose. Do I put food on my table? Do I keep a roof over my head? Do I pay for health care? On top of that, unless Republicans in Congress act, the enhanced premium tax credit for people on the Affordable Care Act will expire at the end of the year. And if that happens, again, people are going to have to choose. They'll see the cost of their health insurance premiums spike, including about 16,000 people in my district. Because of this cruelty, nearly 45,000 people in my district alone will either lose their health insurance or be forced to pay much more. This is a massive betrayal, just days before people are starting to get their notices to Americans across the country. So I have been very clear in my message. I cannot vote to support Republican spending bills until they agree to stop the cuts, lower the costs, and save health care. And I've been talking to constituents in my district asking how will you be impacted with all of this. So the first story that I have is from Steve, who lives with his wife in Beaverton. Steve is 68 and is still working, but he's on Medicare. His wife, however, is only 61, and she won't qualify for Medicare for a few more years. She currently pays $500 a month for coverage through the Affordable Care Act. But next year, her premium is set to increase to $800 per month. And you might think, well, that's only $300 more. She might be able to afford that. But in his response, Steve notes that his wife is a waitress at a small local diner in Beaverton. So an additional $300 a month is just simply too much on top of what she already pays for her health care. She will go without health care and won't be able to absorb that additional $3,600 a month. Another constituent of mine, Linda from Dallas, reached out with a similar story. she's on a bronze plan from the ACA, and the enhanced tax credits aren't extended, her premium will go up by about $1,000 a month. And now that bronze plan really just covers catastrophic. And I don't know many families in Oregon who can afford an extra $1,000 a month or $12,000 a year. And because of this, she says she's not going to re-enroll. She's going to forego insurance until she's eligible for Medicare in about a year. So she's rolling the dice and hopes she will be okay for another year. This is tragic. And what is worse, as you will hear from these stories, it's not unique. A woman who owns a health insurance agency in Independence reached out to my office. She's the only agency in Polk County that works with marketplace clients, and she has roughly 600 clients in the marketplace this year. She estimates that if the enhanced tax credits aren't extended, that she will lose 80% of her individual clients. Most of these folks will end up going without health care until they have to go to the emergency room. And then what? How will they afford a medical emergency without health insurance? How will those local clinics stay in business? Republicans are forcing people to gamble with their health care, their finances, and their lives. It's cruel, and it is entirely preventable. And these are just a handful of stories from over what I expect to be thousands more in my district. And obviously, we are talking about millions across the country. So I am truly worried about Linda and Steve and his wife. And I'm worried about all these people who will be impacted in my district and across the country. I don't know how they'll get their care and how they will address their needs when their costs go up next year. I don't know how our rural clinics will stay open or how senior facilities will cope. But I do know how we can help everyone right now. Republicans can come back to the negotiating table. They can make sure that healthcare is affordable and that we can save healthcare today in Oregon and across the United States.
Let's have Congresswoman Dexter, a
Thank
doctor.
Thank you so much. I certainly am honored to join my colleagues in this effort today. I am Maxine Dexter, proud mother, physician, and representative for Oregon's 3rd. And I'll just start with this. I didn't work for over 20 years as a critical care physician saving lives to just sit back while our healthcare system is torn apart. And that's why, like every Democrat in the Oregon delegation, I'm holding the line for a government funding bill that protects healthcare. I won't roll over, as 24,100 Oregonians in my district will see their healthcare costs soar this year. I'm not going to roll over, as an average loss in premium tax credits for Oregonians is nearly $1,000. Because when costs soar like that, when healthcare becomes out of reach, many people will just simply stop paying for coverage because they can't afford it. And I know what happens when people lose coverage. They skip medications, they delay seeing doctors, or they avoid care altogether. And people suffer in silence until it's too late. And again, I know because I took care of them in the ICU when they pushed everything until they couldn't deal with it any longer, and then they show up desperately ill, unable to work, and then going bankrupt because they don't have the resources to pay their bills. We all pay the price when that happens. Republicans can end this right now. Democrats are ready and willing to negotiate a funding bill that takes care of health care. And these tax credits are the common denominator. At a time when we are debating the very foundation of our democracy, extending these tax credits is just low-hanging fruit. It isn't just low-hanging fruit. It's literally picking fruit up off the ground. I'm urging Republicans to show courage in this moment. Courage is contagious. All we need is a few people in the Republican Party to say, you know what, let's extend these tax credits. Let's get a deal that helps working people in this country. It's that simple. Find the courage to do the right thing. Democrats are holding the line until Republicans find their courage. And with that, I yield back to Senator Wyden.
Well said, Congresswoman. And we've got 3 speakers today that we thought were especially important because, in my view, they are the face of what is happening today in healthcare in Oregon. They are Gail Manasco, who's a breast reconstruction advocate. She's got her own business. She's a bionic woman. I'm not sure she sleeps. She's just everywhere. Lynn Roston, who purchases her family's health care on the exchange. We all know how important this is because Oregon is mostly small businesses and individuals, so that's hugely important. And Dr. Stuart Curry, Chief Medical Officer at Wallace, I know that we went on a little bit. These three are really special. So Grace, why don't you, Gail, excuse me, why don't you start off? Come on up, everybody. Join the party.
Thank you so much for having me. And thank you, Senator Wyden and Senator Merkley and Representative Salinas and Bonamici and Dexter. Gail Manasco. And I'm a breast cancer survivor, and I'm founder of BRA Society, Breast Reconstruction Advocate Society. I am a mom and a small business owner, and I live in Bend, Oregon. 2 years ago, at the age of 38 years old, I thought I was healthy, but I was diagnosed with breast cancer. I didn't know much about insurance. I had it. I knew who the company was. I knew what my out-of-pocket maximum was, but I did not know much else. But I was forced to learn about insurance, networks, and limitations when I was quoted cash prices for my mastectomy and reconstruction, and learning that the Women's Health and Cancer Rights Act of 1998 was still subject to insurance networks and limitations. And I had to navigate the system, and it was hard. And I advocated so hard that I started to learn about health policy change. Ended up championing Senate Bill 1137, which passed bipartisan, bicameral, and unanimous here in Oregon and goes into effect January of 2026, which expands access to autologous breast reconstruction procedures that don't compromise the muscle when there's an inadequate network. Words I never thought I would say a few years ago. But I am a small business owner, and I have to shop for a plan on the individual ACA marketplace. I'm an S-Corp. I'm a W-2 employee of my own business. But the individual ACA marketplace is the only place that I can get a plan because I don't have a common law employee. So I currently have a Pacific Source PPO plan. That plan gives me access to doctors, to centers all across the nation. It works as Aetna for non-emergency care. But I just received a letter in the mail last week that says that my plan will no longer be available on the ACA marketplace. My plan is being changed to an EPO plan, the same type of plan that I had 2 years ago. You may not know what an EPO is, but it's an exclusive provider organization. These Pacific Source plans are actually all being changed from PPOs to EPOs, and I won't have access for non-emergency care outside of Oregon, Idaho, and Montana, which is a big reduction in access. My family, me and my husband and my daughter, we have to have insurance. I'm a cancer survivor. My husband has cerebral palsy. I have a 10-year-old daughter. We cannot afford to go without insurance. My family of 3 right now pays $1,700 a month for our health insurance plan, and that is with a $74 advance premium tax credit. But my tax credit is much lower than what the average Oregonian is receiving. The average Oregonian's advance premium tax credit is $531. Soon, Oregonians everywhere and Americans across the country are going to see the true cost of these plans. My new plan, I'm having to switch carriers. It's still going to be an EPO because there will be no PPOs. But my new plan will cost our family well over $2,000 a month. It's over a 20% increase for me, but it's going to be much higher for many other Oregonians, and it's unaffordable. People cannot afford these plans, especially without the enhanced premium tax credits. And I worry that the people who think that they're healthy are going to leave the marketplace. And then what is this going to leave the plans? It's going to be the people that are high risk, the people who need these plans. And now you've had like the healthy subset leave, And now we are going to be stuck with higher premiums. And my worst nightmare is that these insurance carriers choose to leave the market because of us high-risk people being left on the marketplace. And I worry about all our healthcare systems. I worry about the uninsured going to the hospital. I worry about that hospital not being reimbursed. I worry about our health systems failing and the high medical debt that people will have to incur. I am truly scared for the state of our healthcare. And I just want to thank the members today for fighting for us, because this shouldn't be a partisan issue. This is about American healthcare and access to care. And I'm fighting for women and for people, our cancer patients and survivors. Thank you.
There is not an insurance company around that can keep up with Gail. Lynn, come on, please.
For sure. That's a hard one to follow. Hi, my name is Lynn Roston, and I live in Northeast Portland with my husband and 10-year-old kiddo. I am here this afternoon because the premiums we must pay for my husband's life-sustaining coverage are projected to increase by thousands of dollars. I am no stranger myself to the healthcare system. A few years ago, I was thrust into more deliberate and preventative healthcare when I found out I had a genetic mutation that increased my chances of breast cancer by upwards of 80% and ovarian cancer by 40%. I was lucky enough to benefit from our PPO plan in 2024 and get the best care in the country out of state, marking myself a previvor of breast cancer. Before receiving that genetic information, though, my partner was an unfortunate veteran of navigating the healthcare system due to having type 1 diabetes since he was 14 years old. He and millions of other Americans with diabetes cannot live more than 36 fading hours without insulin. It 100% sustains his life, and he has to fight frequently for the right to pay to stay alive. Now we are being faced with paying substantially more for less coverage. For the purpose of brevity here, I will just mention the $10,000 a month drug that helps his spinal degeneration and pain from a second autoimmune disease, ankylosing spondylitis. Thankfully, the pharmaceutical company has a payment plan that helps cover that drug in combination with the insurance company. But my husband is a commercial director and editor, and I am a photographer, freelance photographer, and because we are self-employed, we very much live month to month. Rent is, of course, our biggest expense, but healthcare premiums will be rivaling that next year without the advanced premium tax credits. Even with subsidies, we continue to get pinched by higher premiums for increasingly reduced access to care. And if we keep the same health insurance plan through the marketplace next year, we will no longer have a PPO plan, as Gail just talked about, but rather an EPO plan that means less options and access. And we will pay over $2,000 a month for the three of us in our family. That's more than 45% higher than our $1,377 a month this year. Bottom line is increased deductibles, increased out-of-pocket maxes, and ever-increasing drug prices pushes this health insurance spending nearly out of our reach. But we can't live without health care. At $300 a vial for insulin, living without health care is essentially synonymous to living without insulin, and living without insulin is not an exaggeration to say a death sentence for my husband. So I just want to thank all of the representatives here. Please don't stop fighting for us.
We're just getting started.
Yes, don't stop fighting for us. We know that that healthcare is not a partisan issue,
Well said,
or
Lynn.
shouldn't be.
Dr. Stewart.
All right, thank you. I want to thank all of our representation here today for fighting for us in Oregon. So I'm Stuart Curry. I'm a family physician. Been in practice well over 20 years. I'm the chief medical officer at Wallace Medical Concern. We are a federally qualified health center, otherwise known as a community health center. basically a safety net clinic, of which there are at least 30 organizations in the state of Oregon like ours. We take care of the folks who either don't have insurance or are underinsured. And of course, we take all insurance as well. But like our wonderful congressman who did it in the ICU, we do it in the ambulatory space. So we get to see them, and we can see them and know when they're going to end up ultimately in the ICU because they haven't been able to access care. So when folks can't access care because of cost, either they don't have insurance or their deductibles are too high. We've heard today that, you know, with the tax credits expiring, even those that may be able to afford these plans on the exchange, their deductibles are likely to go up considerably. And when that happens, it's effectively as if they're uninsured. They don't come in for routine diabetes treatments or visits. A whole host of chronic diseases that are well managed end up being poorly managed, and these folks end up in the emergency room and often hospitalized. We've been tracking metrics like this for years now as part of value-based payment, and these are called ambulatory sensitive hospitalizations, asthma, hypertension, congestive heart failure, a whole host of things that if you can get in and see your doc and afford your medications, chances are you're never going to have to go to the hospital for these conditions until something severe happens or you're very, very old. That happens all the time. I can think back to 2008 when I was in another practice environment and the economy went for a downturn and all the hospitals suffered because people weren't using their health care because their out-of-pocket portion was too expensive. And the net result of that is your emergency rooms become even more crowded than they are now. And of course, people spend way more for health care when they seek care for it later in the stages, and of course, they end up injured or severely sick from it. I just want to make sure that people don't miss the underinsured aspect of this piece. I've seen some data from Senator Wyden's study that was put out that, upwards of 50% of folks may not be able to afford their premiums, but those who stay on it, they're not going to be able to afford to use their insurance. So they may as well be uninsured. And what happens when the ERs start seeing more and more patients that are uncompensated? Costs shift. And you guys can discuss that at will, but the cost will shift. So we'll all end up paying for it. We saw it in 2008 and many other times throughout our lives. When the uncompensated care goes up, all of our commercial premiums go up because the health centers have to stay open one way or the other. So thank you again for all the fight. And keep it up. And just to mention that,
fighting for your patients.
yeah, we do everything we can, but in a center like ours, you know, if you're uninsured, we'll see you. We'll do everything we can. You don't have to pay us any money, but we don't have access to medicines to keep you going. We can get somebody a month's supply of insulin periodically, but we can't guarantee that we're going to have it every month. And we can't do x-rays and CAT scans and diagnostics that might be done. So we can do some, and it feels like people have a place to go, but it's really insufficient without adequate coverage. And I just should mention that we all drove by the ICE facility today, and there's nothing happening. Thank you so much.
The pumpkins will tell you that.
In Rockwood. Rockwood, yeah, East County out in Rockwood.
Good. Okay, let's take a couple of questions, and then we're going to stick around also and visit with people individually. We have two who had their hands up.
Yeah, I'm Betsy with K2, and just for the purposes of attribution, can we know where you guys got some of the numbers about people who are going to be losing their insurance or their premiums will be going up?
Sure, they are the numbers that come from the Congressional Budget Office. They are the official kind of reviewers on taxes. You know, I'm the guy for taxes in the Senate. It's the joint tax operation, but the Congressional Budget Office is the key for the numbers we're talking about, people who are losing coverage.
And some of those numbers come from the Kaiser, some of the ones I use, Kaiser Family Foundation, and I'll have my staff connect with you to put you to the website where they have.
And I just put out a new Kaiser study today, which indicates that the 5 big companies, they're really big employers that are going to administer all of the work requirements and the technical stuff where it looks like people are going to get lost in the bureaucracy, have a lousy track record. So we're getting that out, and we're going to have to do a lot of oversight to make sure people don't get ripped off again, just as they try to apply. I saw another hand, yeah.
Hi, Ariel Salt, 26 News. For the past 2 weeks, I have been covering protests outside
I have been shot in the arm with pepper bullets. I've been basically washed multiple times with tear gas, as tear gas cannons thrown my feet, and shoved. And I'm with hundreds of other Oregon protesters that have been out there. I've witnessed some pretty intense arrests that have happened outside of the Pavilion as well. What are you doing to better protect Oregon protesters and the looming threat of the National Guard coming to our state?
Yeah, thank you so much, one, for being out there. Clearly, you and many other journalists have been putting yourselves literally in harm's way. This is absolutely unconscionable. I'm sure we're out there peacefully, as almost every protester has been. We are seeing increasingly aggressive and provocative action by our federal officers. I think all have been signing on to different letters, different bills, trying to get this under control. But the fact of the matter is, this administration doesn't care about the law or the Constitution. We have the Ninth Circuit hopefully coming back with an opinion before the end of this week about whether or not they are going to allow National Guard troops in to our state, certainly into our city. We know that may go either way. And frankly, I think that is also a failure of our system, that we aren't sure that First Amendment rights are going to be protected. There is no rebellion, there's no insurrection, there's no failure of our local law enforcement to be able to enforce federal law right now. We are in a surreal place where, again, our administration is untethered to the reality on the ground. So it is literally in all of our hands right now. We have all been encouraging folks to be using their First Amendment rights to protest, knowing that they are potentially going to face ridiculously aggressive action. Not taking the bait, I think, still is incredibly important. We all have, you can protest wherever you want, I can protest wherever I want, but being at the ICE facility right now is asking for the escalation of action against our protesters. So I would encourage folks to be out in the public, to be peaceful, to remain resistant, but we need our judicial branch to step up. We in the legislative branch are certainly doing what we can, but until our Republican colleagues also find their courage, we are all facing escalation of power and frankly an authoritarian takeover by our government, and we all need to stand for it.
When Noam was in town, I made a special effort to say, you're supposed to get out and listen to journalists. And basically all she did was put herself up at the top of the tower and walled herself off. And I'll tell you, my biggest concern right now is not even a court. I think that there's always the threat of the president invoking the insurrection statute. That's what I think is big, and what we have to do, you probably saw that we're trying to be a little bit sarcastic about what he's always claiming. We have to just push back every way. He doesn't like bad press. He doesn't like the fact that we're showing how safe and vibrant we are. We're not going to minimize how serious this is. I just gave you 2 examples of things we have to do in terms of reporters and journalists and being vigilant about the Insurrection Act. But we are all in this fight. This is not something that you can just spend a couple minutes a day on. This is something that is all about the fundamental values of this community and Oregon. And this is a hugely important and tough battle, and we are in it every step of the way.
I just wanted to add one thing, and Representative Dexter was right, that they don't care about the law or the Constitution, and they also don't care about the facts. Because as you know, the ICE Center is almost 2 miles away from downtown, and the picture they're portraying is that downtown is burning and war ravaged, and we all know that that's not correct. I just wanted to add with regard to your specific question about what are we doing and what's happening. We do, after a recent visit to ICE, several of us sent several different letters, because some had to go to ICE, some to the Federal Protective Service, some to the DOJ. And specifically, we're trying to get more information about what they're using, munitions, and how they make the decisions, and what it is that they're spraying. Because the Cottonwood School down there, the residents who live there, my constituents, they are extremely concerned about the air quality, about what they're putting in the air, but also the the noise from the helicopters that are circling constantly. So we're, as far as I know, we haven't received any responses, but we're going to keep after them to try to get more information about how they're making these decisions and what it is that they're using, because as we know, too many people have been harmed already.
Portlanders are demonstrating with joy and whimsy, which is proving very irritating to President Trump and his cabinet members, because they came here to provoke violence and use that violence as a foundation for increasing authoritarian control. I just went by ICE on the way here, a little bit of whimsy, a sign that says cruelty is ungodly, and a little dinosaur, and there were other nice, very nice groups down there, but I want to thank the women who have gone down with pastries and pajamas to be handed out. I want to thank the folks who went down with the puppy dogs and had paws, as in P-A-W-S, Paws for Peace, and the wedding that occurred, and the red carpet, and the dancing and that was going on. Not the electric slide, what was it called? The cha-cha slide or something of that nature. And it's so important because from the first press conference we had with the mayor, we said, don't take the bait. We understand what President Trump is up to. And Portlanders, in the face of provocation by these federal agents, have been so restrained and have responded with this joy. It's an unusual way to protest, perhaps, but it's the right way for the moment. The president has attacked due process, freedom of speech, freedom of the press. He has weaponized the Justice Department to go after folks that disagree with him. And now he wants to set the path that enables him to be able to send the military in to attack peaceful protesters. This is authoritarianism that is not around the corner, down the street. It is here right now. And we are united in standing up for the vision of our Constitution with its checks and balances. It's three things that put you in an authoritarian state. And one of those is a rubber stamp Congress, and we have it. And the second is a Supreme Court that hands more power to the executive, and we have it. And the third is an authoritarian president who ignores the laws that apply to the executive branch or the separation of powers, and we have it. So this healthcare debate, or this healthcare moment, this is part of a broader challenge. Why is it that our Republican colleagues are unwilling to join us in this fight for their constituents? 3/4 of the folks who are going to face those premium reductions are in states that President Trump won. And it's because they've come a rubber stamp for an authoritarian president. So the health care fight is one piece of this broader puzzle. We're all in it, united, and we're going to stand strong on health care, but we're going to stand strong for our Constitution and government by and for the people.
Also, I wanted to add that this is a bipartisan effort now, because one of our colleagues, Marjorie Taylor Greene, who I never thought I would agree with, discovered through talking with her children who get their insurance through the exchange that their premiums are going up. It shouldn't take somebody's own child to be affected when their own constituents are affected. But I just want to say, I hope more colleagues on that side of the aisle listen to Marjorie Taylor Greene, come back to DC and get this through so that we can preserve health care and stop those increases.
The Congresswoman is going to be our last speaker, and then we're going to come out and talk to everybody who wants to individually, okay?
I would also say, while Republicans are in control, we do have an oversight committee in the House, and we are gathering evidence, and I don't want there to be a dampening of our First Amendment rights, especially with the press right now. And so when you see something or you experience something, please let us know. We represent you, and we take the evidence that is happening back to our ranking members. So Robert Garcia is taking evidence of what is happening right now in Chicago and in Portland. And when the time is right, we will have that evidence for whatever hearings may come up when we're in the majority post-2026. So please don't let inaction right now or action because we aren't in the majority, don't let that deter you from holding Trump's actions accountable right now. We may not be able to do a lot with it right now, but we will one day. So we are keeping score. We just can't do a lot with that score tab right now.
By popular demand, there is more.
Alex and then Heather.
Okay, Alex,
Thanks, I appreciate it.
didn't see ya.
I do the mayor motion Q&A. We're looking, this is a shutdown question. You're already seeing sort of reallocated agency budgets happening outside of congressional oversight, so defense R&D money to salaries, USDA moving tariff money, take a break for a month. What are you all doing now to ameliorate any of the damage you come back to when the door reopens? And then my second question to that, anybody can tell me, has anybody had a conversation with Representative Cliff Benz, your one Republican colleague in Congress? It's one thing to say, you're not talking to Republicans at large, they're not talking to you. Can you at least get the Oregon one on the line?
Jeff, Alex, let me give you one quick point with respect to the money side and then turn over to Senator Merkley, who's our point person for the Budget Committee. Senator Rand Paul and I probably this week are going to try to overturn Trump's tariff regime. We lost before on a 49-49 vote, and now we have some senior Republicans. There's an article that basically says America is eating the tariffs. We're basically, with all the increases in grocery stores and the like, people are furious about these increases. If we can take back that tariff money, we'll be on the way to having a new authority with respect to finances, and I'm hoping we'll get it to you. Hank will get it to you. We can get that vote this week on unraveling Trump's ridiculous tariff powers, which, by the way, are hugely bad for Oregon jobs as well. Let me have Senator Merkley give you some more budget insight.
So here in Oregon, we have 30,000 federal workers. 1/3 of those workers are for Bonneville and other groups that have their own funding. Another third are designated essential. That leaves 10,000 that are essentially on furlough. Let's recognize how hard it is for folks to go without paychecks, and how hard it is to have a government that treats you like rubbish. Now, the architect of this strategy is the head of OMB, Russell Vought, he's architect of Project 2025. He said, my goal is to traumatize our federal workers. I want them to feel so much like victims, they don't want to come to work. Well, I can tell you, our viewpoint collectively, if I can speak for my colleagues, is we value those who work, whether it's in healthcare or housing or transportation or education or just making the gears of government turn when people sign up for a passport or register for Social Security. We value the work they do, the contributions they make. And so one of the pieces we are going through is this absolute assault on those who have stepped up to do public service to serve the nation. And we stand with them. Unfortunately, this is a Republican shutdown. It's going to end when the Republicans decide not to savage health care for millions of Americans. But in the meantime, folks, there's going to be suffering for those who want services they can't get, and certainly suffering for those federal workers who are not getting paychecks.
Let's hear from Congresswoman Dexter.
Yeah, I just wanted to add to that and to answer about reaching out to our Republican colleagues, Alex. So number one, part of this standoff is to get to an ironclad agreement. We cannot come back, vote for a budget, and then just let Russ Vought and Donald Trump do whatever they want with it. So we need to make sure that it is ironclad and that we get the power of the purse back, at least for this budget, into Congress. And so that is part of the bill that has been voted down, I think, 7 times now on the Senate side. As far as talking to our Republican colleagues, I think it's extremely important. And I don't believe our country can work when we are in these partisan divides where we don't talk to one another. For example, last week, a week and a half ago, a colleague of ours on the Republican side said something just patently false about Portland. And so I called him. He's in my class, and he was very receptive, and he literally thought that what he was saying was real. There is a just parallel universe that does not correspond with reality that they are getting their news from and information, and we have to address that, and you all in the free press are really part of that. Next, Cliff Bentz has always answered my phone calls. Cliff and I have talked multiple times in this period. We are talking about healthcare, trying to convince him that it's not a bait and switch to have a conversation in the Dells. I continue to offer to do a combined roundtable, private roundtable without press, so that we can talk about the real impacts on the district. And there's just so little trust that he's concerned that, you know, there's going to be some nefarious outcome that I'm trying to drive for. And I don't blame him. I mean, we are in a time where there's too little trust amongst our colleagues on both sides of the aisle. I continue to reach out to the Republican physicians in the House and the Senate, and there is a physicians to be able to open practices and stay open, that we need Medicaid coverage, but we aren't aligned on how to get there right now. And I do think that what has happened is that we're a rubber stamp body for President Trump, and until they realign themselves with the powers that they have in Congress, we are going to continue to have a failure of government.
If he is reined in on tariffs, Alex, that is the beginning of a new approach on budgeting, and it's going to be close. Why don't we do Heather and one other one, and then we'll call it.
And then we gotta go.
Okay,
Mine's
Heather.
very, very quick, because part of it was Alex's question on Congressman Bentz. He said in an interview recently, we just need to get Democrats to come back and pass the budget, and then we will talk about the rest of your concerns. So how do you respond to that? And then also he said that he did not directly address troops in Portland, but said that he believed federal intervention was necessary. Portland has changed so much in the last 20 years. So I'm just curious your guys' reaction to his comments.
Every conversation I've had with him, Heather, has always been based on something that constitutes a mutual approach. You can't just do this negotiating with yourself. You've got to come to a room. I just mentioned the snacks kiddingly, but not completely. And then you get to work. That's how Mike Crapo and I, who's now the chairman of arguably the most powerful committee in the Senate, we put together a 26-0 vote reining in these hugely powerful insurance companies that deal with pharmaceuticals. There is no substitute for that. You've got to sit there and exchange ideas and start working to narrow the differences. And in the Senate, Senator Merkley and I are constantly in the front of those discussions for the very reason you're talking about. They're essential to getting it done.
Well, we all served with Cliff, everybody in the House, it's one point or the other, served with Representative Benz. With all due respect, we, at this point, cannot support a budget that locks in these healthcare cuts and then expect them to fix it later. It's just, we're not in a Congress where we can trust the leadership to do that, where we can trust our colleagues to do that. So we need them to get back to the table and figure out how we can do it now. And I know the speaker said, well, we'll do it later. It doesn't have to be done till December. But people are getting their notices right now. They need to make decisions right now. So if in another Congress, I might say that would work, but in this Congress, we need to lock in some, we won't lock in these cuts because the rescissions, the undoing with either OMB or the administration of the work of Congress, we just can't do that. It's too risky.
Hank, did you say there's
Last
one?
question to Tara, then we have to wrap
Tara.
it up.
Okay, so following up with all of the healthcare questions, because that's what we're all here for. Your Republican colleagues don't care if we have healthcare. They're trying to make sure that the Epstein files aren't released, and I believe that they're using this healthcare as the excuse. So how do we leap over this healthcare hurdle and get the 218 persons sworn in so we can have that vote, and you can continue your work, Senator, working on the financial ties between Russia and American banks and the Epstein sex trafficking ring? I believe that they're using this as the excuse. They could not care less about our health, and they've made that really clear. How do you approach enough Republicans to move forward the resolution and get it passed?
Let's get an update because I know they're working on it.
I think you are absolutely right. I could not agree with you more. I am outraged. Adelita Grijalva is not representing her constituents. She's still a representative-elect from Arizona and a new member of the Congressional Hispanic Caucus. I cannot believe that Arizonans and people of the United States of America are allowing this right now. And actually, I mean, to Heather's point, the trust with the American public has already been broken on health care. And so I think right now Republicans are telling the American people, we actually don't care that you are going to be paying thousands of dollars more, or you're going to go without health care. And guess what? We have health care. We don't really care about you. I think that's the win right now. I think we have Marjorie Taylor Greene, Lauren Boebert, Thomas Massey. We get Adelita Grijalva. She's our 218th. We open up the Epstein files. We make sure we all take that vote, and then we get to work back on health care, and we restore the American people with the health care that they need, and we make sure that we expose children trafficking for what it is.
Okay, here's what's going to happen. We'll stick around for those who can to answer questions individually, and the last speaker will be my friend, Senator Merkley.
So on Epstein, the first is that Ron's leadership on the Finance Committee and the investigation that he's been working on for years has been incredible. The number of transactions they uncovered and just a huge amount of work to show that this wasn't just a man having a few liaisons with underage women, which in itself is rape and terrible, but a whole global empire of sex trafficking. Meanwhile, the Senate has voted because I wrote a bill for full release of all the Epstein details, and Senator Schumer took my bill, and when there was an open amendment opportunity, he proceeded to put my bill up as for an amendment vote. The vote was 47 to release, every single Democrat, and 53 no, every single Republican. And quite frankly, I was stunned by that vote. The fact that not one Republican would stand up for full disclosure on a massive empire of rape and abuse of young women. Not one single Republican would stand up. So I don't know what's going to happen in the House vote. I hope that the folks who have signed the petition will in fact stay the course and have the majority vote. I hope that will then come back to the Senate and we will get the full release of that information. This cover-up is a horrific offense to justice, and not just criminal justice for those who did wrong, but justice for all those who were raped and abused.
Okay, everybody, thanks for coming.
Let's get a quick photo of all.
Oh, good.
Right here.
Hey, Gail, everybody, Gail, I want you right here.